We finally had a breakthrough, and it's for the better. And the government is committed to giving treatment, so we want to help them do it. So I think as much as it's frustrated us, I think in the long time it's a much better.
This is a genuine breakthrough. It's not one of the several meetings.
No. This is a commitment. They are delighted to have us. We're delighted to be there.
The fact that they've asked us to assess the clinic for them and give them the feedback, and now they're coming this afternoon to actually look at the Carlisle Street clinic. So and the manager, they reiterated that they're very happy for this.
The dotted line hasn't been signed, but we anticipate it in the next week or two at the moment.
And the thing is that the model that we're proposing, they actually already know that it's working. So as I said to them, we're not coming with a model that we haven't thought about and we haven't seen it work, we haven't tested. We know, but what we want to do is improve on that model. And the fact of improvement is giving you CD4, results quickly. We're going to have all these on-site, which we know work, but we want to use them in our hands and validate that they do.
It's all done WHO recommendations, but now to actually implement it into ours. So
Let me introduce you to Zoe. She's the second in charge here, so we'll show you her little palace.
So this is our pharmacist. Her name is Aruna. There's another room at the back there where we keep all our products. Unfortunately, we're just allowed to go in there.
We are running a blinded study at the moment, so for that reason that room is kind of restricted access, only 2 pharmacy staff, and that's just to maintain the blinding in the study.
From here we're gonna go down to our clinical exam rooms. That is where the participants are seen by the clinicians as well as the nurses for physical exams, and that's where the pap smears are done as well, or the pelvic exams. These small rooms are CAS rooms. We have these small computers. They're just some personal questionnaires that are asked participants, so they use the computers for those questionnaires.
Should they fill the questionnaire themselves?
Yes, it talks to you.
Okay.
The computer talks to you, and then they just have to press yes, no, or whatever. That's all. And it's basically quite intimate questions, because being with microbicides, a lot of sexual health, that type of thing. And they, as Zoe says, they might not feel comfortable if you're asking it, and they might lie. They might say, yeah, but we're here, nobody's listening, and also you're a number, so they don't know it's you.
We used to scan the participants' IDs when they first come in, just to make sure that they are not in the system already.
It's called a biometric fingerprinting system. Has been installed in other clinical trial units around the country, because not only undertaking the same clinical trials, doing vaccine trials, so participants not only could jump into the same trial in different places, but they could go to another clinical trial. So say that they're doing microbicide trials, it could be a vaccine trial. Now you're not supposed to actually co-enroll in different trials. So it could be, you could track, exactly.
But the prerequisite has to be the common database, and that.
Yes, definitely.
This is our data room. The lady here is our data coordinator. Her name is Tolly.
I do filing, locator filing, where the locator is where they put in information about that particular participant, personal information, contact details and everything, so that when they come back to track them for their following visits, they are able to get hold of them.
We take the locator information so that we can contact them or go and visit them if we need to. So it's quite a detailed, what we call a locator. It's what we've been using on the clinical trials. We get their ID, and then we have a checklist of all the things that we need to do. And so we can see here that she was HIV negative. So then she's counseled. If she's screened for TB, there's a TB screening questionnaire. and if she's got no TB symptoms, that we've written all down about the counselling and everything, and then she's told to come back annually to retest again. When she's positive, we can't initiate ARVs, and that's been our stumbling block. So we say go to DOH, and they all look at you and say we don't want to go to DOH. So we now are going to really happy that we will be able to offer them the rest of their treatment, through DOH
And manage them ourselves.
And manage them ourselves, because
Build
that's
that
the
trust.
retention in care is the problem. Many people have been tested, but few of them are actually, they know they're HIV positive, but they're not following up their CD4s or getting treatment, and they wait till they're very sick, by which time it can be too late. So we're really hoping by having a one-stop shop that they'll come in and they'll stay with us and stay in care with us. So that's why this link with DOH is so important.
Also, what we said yesterday to Etequini was that the documentation is, as we said, the registers are cumbersome. But even this type of documentation, the locator, just simple things that they don't files.
Unless you're on ARVs, you get a file, but
You
the
get a
other patients
file.
don't have a
But
file.
there's no history. You don't know what's happened, when they've come in. So simple things like that we can introduce. And it's easy to pick up the patient, know exactly what's happened before, And the second thing was we said that we want to have family-centered, because they're not starting ARVs on children. So we want the family to come in. If the child needs ARVs and the mother, not that the mother goes somewhere, comes here, and now we've got to change, send the child somewhere else. So we want a family, and that's how we can also attack the male. The partners to get
We've had
more
quite
men.
a few men.
Men,
We've had 4 or 5, which is the only women who come to the clinical trial. So to have 5 guys into the wellness program has been, but they want, if there's a relationship, they'll come.
So basically, we were asked by the Etequini municipality to come and evaluate the site, the Lancers Road Clinic.
I think there's an opportunity for public-private partnerships, because the little things, the private sector, if you can't give them the entire burden of those little things, it's far easier to get the private sector involved. And things like additional rooms or additional staff.
Exactly, that's what we will provide, and mentoring. We said yesterday we will provide that mentoring. We want to put a doctor on site every day, half a day, to help the nurses, to get you up to scratch, to help you to mentor, So little things like that. At the end of the day, it's going to make a huge difference. And you'll be able to say, look, for this number of patients, this is the staff you need. There's enough rooms there. How many we've got? 10 counselling rooms? 8 counselling
8 counselling rooms, and we've got 4 clinical exam rooms. You've got a big waiting area. You also got the awning.
Basically, that's what we're proposing, is that we move here.
Prefab, so they're going to allow, obviously,
Well, the municipality have got no problem with